Welcome to the Introduction to Dentrix for Dental Assistants. I'll be taking you through the different screens and segments of Dentrix that are essential for the dental assistant at Jungle Roots Children's Dentistry. This is the main desktop. You're looking at the remote connection by virtue of looking at the top bar here. You'll see this in Gilbert. You'll see this on some computers in Awatuki. And some computers in Awatuki just have the main desktop they're familiar with from using Windows at home. It's all the same interface. I want everybody to start off with the appointment book on. That gives you a heads-up view on exactly what's happening around you, and it's the launching point from managing all the different aspects of Dentrix. So this is the appointment book here. You would simply double-click on it with your left mouse key. Come over here to your login credential screen. You simply type in your login credentials that were provided to you by the administrator at Jungle Roots. And you'll be brought up to the schedule. I'm going to quickly go over to Saturday, simply because we don't want anything to be viewed prior to that. I'm looking through here and I need a different view, it appears. There we are. Great. Alright, so here we are on Saturday, July 26th. We have two appointments here. And this is your main launching point screen. It'll certainly have quite a few additional appointments on here, but this is a good starting point for everybody. My son AJ Culp is listed here. And from this point, say you're in the operative side and AJ's coming in for restorations, you want to access the dental tooth chart, which is indicated right up here on the top left side, indicated by the tooth. Anywhere in Dentrix that you see an icon, you can simply highlight or just hover your mouse over that particular icon, and it'll tell you exactly what the icon stands for and what it'll bring you to. But in this case, we're going to be using the patient chart or tooth chart. So the best way and easiest way to do that from this point is to simply left mouse click on the person's appointment, go back over, and then select the tooth chart. When you do so, it invokes the tooth chart itself, and it'll bring its view up right here. And here we are. We have the typical view of the cartoon teeth here. We have some procedure buttons on the right hand side, which are very helpful and customized for all of our needs. And then we have a series of progress notes and clinical notes here on the bottom. You'll notice a couple different colors in the tooth chart, and that's very helpful because it gives you a visual representation of what this person has been through and areas of concern. These colors also correspond to these buttons right above, and if you're entering specific conditions or specific restorations that either were done in other facilities, need to be done in our facility, or have already been treated in our facility, they correspond nicely to these colors. For example, the green colors that you're looking at down here represent previous restorations that were placed in an other office. And so if you look up here, it says existing other. This is an important function of treatment or appropriately documenting a new patient. That's when this is used most often. The next color in line are red colors. These are treatment areas or things that need to be cared for in the patient's chart, whether it be restorations or other procedures. And again, they're treatment planned by clicking this treatment plan button accordingly prior to selecting teeth. You have the blue color, which has previously been treatment planned but subsequently has been rendered or has been taken care of. And again, this is existing treatment. The final couple of colors here are more or less conditions. Any black colored material on the tooth itself is a condition, not necessarily something that needs treatment, but something that needs to be brought to your attention each time you look at the chart to make sure that you follow up with a particular issue. This particular color right here represents a condition known as hypocalcification. and that's something that we'll see from time to time. Specifically, you're looking at the working chart. There are four chart views: the treatment planner layout, progress note layout, full screen layout, and work chart layout. We're looking at the work chart currently, as we said. The full screen layout is clicked, and you have a very nice view of the person's teeth only in the cartoon chart. Very useful for acquiring images for recall status, so that we can track and keep track of what the patient looked like at each recall visit. We take a screenshot of this and paste it in the patient's document center right here. The next view is the progress notes, which basically shrinks this tooth chart down to a decent size. You can still read it and see it, but maximizes this selection down here. You can do that in another couple of ways as well, simply by, if you watch the cursor, it'll change to this bar shape. If you press and hold the left mouse key, you can lower that, making that image as big as you'd like to, and of course minimizing the progress note section, or you can grab it again and slide it all the way to the top, making the tooth chart incredibly difficult to read, but maximizing this progress note section. Again, the makers of Dentrix have simply kind of made a compromise when hitting the progress note section, and made everything to this degree. Over here you'll see the sidebars. If you simply, I have not pressed any buttons on my mouse, and automatically procedure codes come out. We don't use procedure codes very often because we have customized this section of the chart to fulfill all of our needs for all of our dental codes that we pretty much use for every solitary patient. It's really a good tool. So clicking that keeps it, I believe, right here, pinning it keeps it solid in that particular area. You can again expand or reduce the size of the window simply by moving that back and forth like that. The final view again is the treatment planner layout, and this is used primarily by the ladies up front because it gives them access to the treatment plan case setup, but the majority of the time we simply use the work chart right here. So for the most part, that's all that's entailed with the tooth chart. Very useful, very helpful, and essential in using for the back office. Alright, so we're going to move on to the next segment of the Dentrix program, which dental assistants helping out in the back would be using from time to time, and that is referred to as the family file. Right here you have the file icon with two people indicating a family. If you're interested in accessing the patient's that is already up in reference to the patient chart, that's perfectly fine. All you have to do then is just slide the cursor over, click the button, and then instantly you're brought over to that person's file. It's very helpful. It provides a lot of information. It tells you how old the individual is, their birthday, when their last visit was, how many appointments they missed, contact information via email, of course the patient's name and address. It also provides and is very helpful for mixed families or blended families. We all have the same last name here, but you'll have lots of people we take care of that don't. And one person, as long as you select the right person in reference to getting them entered in the computer system correctly the first time, would dictate and demonstrate all relatives in this area. So that's very helpful in how that works. You can see the word no note right here, and that means there's literally no note in that area. If there is a note, there's a little box that shows up here called View. I'm going to go ahead and double click on Patient Notes, and it brings to light this box. You can type anything you like in this area. I'm going to type in just a quick note here. And then hit OK. When I do that, you see that no note disappears and then View appears. If you click that, and then you can read the note here. There's another location where you can read the note, and we'll talk about that in just a little bit. Here's the referred by section and the referred to section right here. Very important to keep track of that, and that will be a subject of additional video utilization. So that's pretty much it for that. We're going to continue to review materials as time goes on. Back to the cheat chart here. We talked about the different colors and what they mean. We talked about the sidebar here and its procedural buttons. We'll get to that, the use of these buttons, in a subsequent video. However, I'd like to spend the next little bit of time talking about this window down here. I'm going to go ahead and enlarge into the progress notes view, which minimizes the cartoon chart, maximizes the whole view of everything here, and show you what this can do. Currently, progress notes is selected. You can see that this window down here is also selected here. There's another section called clinical notes, which we'll get to in just a minute. But these buttons are the toggle switch that allows you to look at certain items on the screen. For example, the only two that are highlighted currently is the TX or treatment plan button and the completed work button. So what we're going to do is deselect both of these by selecting them or hitting the left mouse key. And you'll notice that everything disappears. This can get quite cluttered with all of these items, and if you're looking for a pure view, say for example we want to look at everything that AJ needs in the realm of a treatment plan, you would simply come over here and hit TX, and everything in red shows up here, which is exactly what's on here, as well as their cleaning and all the other items that are listed. So anything in red is something that we still have to do. Say you're not interested in that. Say you just want to look at all of the conditions that AJ has. You would deselect the treatment plan button, go over here to conditions, which is a little magnifying glass, and click it. And again, only the conditions demonstrated. If you want to make a note specifically, and sometimes you'll have little notes that show up in this section, they're important to read if you're interested in that particular area. For example, I will double click on this incipient caries 23, tooth number 23, and brings up the note window. You click here and we'll just write a note. AJ needs to brush better, and then hit OK, and then you'll see that the little music note shows up here. So if I come back in this chart and I see a music note and I'm interested in this particular condition, I might be inclined to double click on it to read, well, what the heck did somebody find interesting enough to note there? And it's valuable information. In fact, it's essential information, because that's exactly how we relay pertinent information to the next person in line that's reading the chart. Okay. Again, this screen can be up and down, and made to be as comfortable to view as you possibly like, utilizing this icon or this bar sliding device there. So again, typically I have noticed that most of these situations are selected all at one time, and again it gets kind of cluttered, but you can customize this every time you sit down to your workstation as to whatever you'd like to do here, so that's no problem. You'll click down here to, or you'll see down here it says clinical notes. If I click this tab, totally changes the view. This is equivalent to progress notes from paper charts. Essentially, each time a person comes into the office, their visit is documented, and this is where it's stored, right here in the clinical notes. For example, if I double click on the entry for 7/16 and then click here, you can see exactly what was presented and done for that day. This is not accurate, but if it was, you could read back and know exactly what happened, how they did, what we did, and what our next plan is for the future. So very, very powerful tool, very essential tool in a day-to-day activities of a dental assistant.